Hey, it's Dr. Reed with ManualTherapist.com, and I'm here with Dr. Ryan Klepps of StriveHub.com, and I wanted to do a quick interview with him about his really compelling product that was introduced to this a few months back, and then again to the much less beta version. And I think it's a great product if you have a private practice, you're in physical therapy, or you're marketing to things other than physical therapy, like chiros or anything other practice?
We do, but we're primarily working with physical therapists right now.
Okay. All right. Well, Ryan, why don't you give us a very quick interview, and then you can get into demoing the product and why I think it's so awesome.
Sure. So I'm a physical therapist, and myself and another physical therapist, Scott Hebert, started our company a few years back, mostly because we started to notice two things. The first was that we had a hunch that a lot of patients were dropping out early in care. And there really wasn't an effective tool to start managing patients within their course of care. And then past that, every physical therapist we talk to, specifically clinic owners, would say, yeah, word of mouth marketing is like my most effective way to get patients outside of direct doctor referrals. But there really wasn't a system to start managing how that word of mouth took place and how, to specifically grow using your customer base. So for us, we kind of started imagining what a platform would look like that did those two things. Started developing it, and over the last couple of years have kind of really honed in on what StriveHub looks like.
All right, and you can give us a demo of the product and its features?
Yeah, we can do that right now, actually.
Alrighty.
Let's see. So we'll do entire screen here, and that's you. So this is StriveHub, right? And so essentially, the fundamental thing that StriveHub can do is it can allow clinics to send the right message to the right patient at the right time, right? So for instance, just as a quick overview, if you wanted to send a welcome email to every single one of your patients, you can just come into workflows and say, I want to send my welcome email, which we've created before, and I'll walk you through all this before, but just conceptually, I want to send all of my patients this welcome email 0 days after their initial evaluation, save and start. And essentially now, whenever a patient's initial evaluation date comes up, we'll make sure they get the welcome email on the day of their IE. You could obviously do this well beyond that, and 3 weeks, 2 months, 4 years after their IE or after discharge date, all that good stuff, right? But the power of, that's sort of the right time piece. What we really do in terms of right patient is we allow clinics to start diving in and creating these really cool in-depth lists of patients based on the demographic information, diagnostic information, and a lot of other cool stuff like their satisfaction with care that we're pulling from the EMR and also generating on our end. So let's say, from a use case standpoint, you found this really cool blog post on the StriveHub blog that was about persisting pain videos, that the Lorimer Moseley TED Talk, as well as just an overview of what pain is. And you wanted to send that to your back pain patients and neck pain patients, essentially your spine patients, a couple days into care. I'll show you from end to end how that would work, right? You would say back and neck patients, and then be able to start segmenting and pulling those people out. So you could say body part is equal to lumbar low back. And then you could also say body part is equal to cervical spine, right? And we'll pull all those people. Now, there are a lot of added things you can do. You can say, I want my age on my low back people to be over 20, but less than 60. I want them to be from just my Boston clinic. And I want their primary therapist to be Ryan Klepps, right? So essentially we populate all this information automatically based on the EMR import that we're getting into the system. It's not something that you have to define. For right now, we'll just do it simply as lumbar low back and cervical ICD-9s. So we just take the ICD-9s, turn them into body parts. Pretty easy. Create that list, and that's 34% of our population. Again, this is a dummy list. These aren't actual patients. And then the content itself, right? So like I said, you found this really cool persisting pain thing that we made, and you're like, okay, I want to turn this into a blog post for my clinic. So I already created it as a blog post, but I want to show you exactly how you would do it. You would just name the post and then pop in the link, right? So this is the link, and then you would create an associated email that would go out to your patients, right? With your spine pain explained, where you can define what that blog post is and update the post. Now, what we do is we take that sort of ugly post that is on our old TheraVid blog, and we put it within a really pretty template that is branded to your clinic, right? So if we go to view live, this is actually what the post looks like, right? Where your clinic's logo is up here, they can request more information, but they scroll down and the videos are embedded right in there. They can play them and do all that good stuff, right? And then for you to automate this, where every single patient who fits these criteria gets it, it's as simple as going into a continuous workflow and saying, lumbar, cervical, pain info. You could describe it if you want, but now we know who we want to send it to. So right patients. So we say, what did I call this list?
I don't know, lumbar and cervical. Yeah, back in, that's right.
Persisting pain videos, and we want to send that 3 days after initial evaluation, save and start. Now, again, 3 days after the initial evaluation, patients are going to receive that information, right? So this is cool. Did you have a question, Urson?
Yeah, I thought you could also do it, I think in the demo you showed me last week, you could do it before their visit. So they kind of can prep them on the whole, those 5-minute pain science mini snippets. And I thought that was compelling to do it before.
Yeah, you absolutely can. So we have our content, low back pain pre-IE information, where, it's just your back pain explained. It depends on how you want to do it, where we just created this evidence-based packet where we describe what low back pain is, physical therapy's efficacy in treating low back pain, what they should expect on their IE, what their therapy plan of care is going to be. And then it's like, hey, click here to check out the 3 most important things to keep in mind before your visit. They click in, and we just popped in, motion is lotion, hurt doesn't equal harm, and if you have significant changes in your symptoms, contact your doctor immediately. Bowel bladder stuff, numbness and tingling in the groin area. And then, you can automate this to say 3 days before initial evaluation. That's simple. So that's in the system as well.
Great.
Cool. So now, one of the other things that what we do is, in terms of course of care, one of the things, like I said at the beginning, that we had a hunch with was that a large proportion of patients don't drop off pretty early in care. And we validated this. We actually looked at 30,000 pieces of claims data. What we found is, we only looked at outpatient orthopedic claims within a specific geographic area. What we found is 20% of patients go to 3 visits or less. So there's a huge issue with patient drop-off. And then what we did is we said, okay, we have this hypothesis that people who are highly unsatisfied with care are the people who are dropping off earlier on. So we ran this with a couple of our clinics, and what we found was, in fact, people who score low on a survey that we administer go to 3 less visits than people who score high. So what we allow you to do is automate the delivery of this survey. It's just we use the Net Promoter question. It looks like this here. Let us know how we're doing. How likely is it that you would recommend this clinic to a friend or colleague, right? To all your patients at, maybe 3 days or a week. We tend to like to do it early on, in the middle, and then at the end of care. But I'll show you what we can do here. We can start to flag people who are scoring low on the NPS survey and allow you to start remediating as a clinic, right? So I set this up pretty easy, but as you can see, we're going to send the list is just survey list, but you would select all patients, send the NPS survey, and send now. And hopefully, if this wants to be absolutely instantaneous, which we'll see if it does or not, it does. Okay, so we're going to send that information. Again, it's going to be from your clinic to this patient. And let's see, what's this patient's name? Lewis. I think it's Louis C.K. because I just made up a bunch of names. But
nice.
Let's say they score a 2, right? what we do on your end is they automatically get funneled into the unhappy customer low NPS score list, right? So he immediately goes into there, and you're going to be able to see that this person has scored low on the NPS, they're unhappy. But what we also do is you're going to get a low satisfaction survey score submitted as an administrator, right? Almost immediately, as you can see. And then you can come in and you could say, hey, oh no, someone scored below a 7. What should I do? You click, you view the patient information, and we'll let you know who it was, right? And actually, I actually sent one of these earlier in the day. So this is the one we want to look at here, right? This is the one where if you view patient information, it's going to pull up Louis' information, right? Where you could say, all right, his primary therapist is Ryan. He's at our Boston clinic, and his net promoter score was a 2. I'm going to get in contact with Ryan over at the Boston clinic and let him know. And we're going to, formulate a strategy to the next time Louis comes in to talk to him and try to understand why he's not happy and remediate as needed, right? So just having that power of being able to flag people who aren't necessarily satisfied with care is important in starting to actively deal with patient retention and boosting, turning those 3-visit patients into 10-visit patients and turning unhappy people into evangelists, right? So in a nutshell, that's how we deal with patient retention. But on the back end, on the flip side, when we're sending these surveys, we're allowing clinics to start to understand who their customer evangelists are, who the people who are most satisfied with their course of care are, who are most likely to tell their friends and family, right? And as we know, the Net Promoter Question does an excellent job. When we talk about evidence-based, the Net Promoter Question is an evidence-based tool. Lots of people outside of healthcare use the tool to be able to find their evangelists. And there's great data that shows that evangelists actually are, the people who score 9s and 10s, actually are the ones who go out and tell their friends and family and do those types of things. So what we can allow clinics to do is make it really, really simple for these people to either get funneled into post-discharge classes. So you can say, I want my evangelists to receive information about my wellness course one day after they're discharged, and they can go to a landing page and sign up right through there. But what we can also do is send them a simple review email, right? Where we're saying, hey, so-and-so, how often do you check out online reviews? They're pretty important. We would love for you to take a second to share your experience with our clinic on Google+. We make it easy for them to submit the review. They click and it goes to the Google+ page, and to make it, they can leave the review.
Is that Google+ page integrated with Google Maps? Google Maps has a kind of their own, I forget, the competitor for restaurants. You know what I'm talking about, like the business review?
Yeah.
Is that integrated? I forget.
Yeah, it is.
Okay,
that's why we chose Google Local, is because it affects your search engine optimization ranking. So if we start to look at some of our current customers, right, where you're looking at physical therapy, Wellesley, like we're getting our clinics to start to rank when they weren't ranking before. Train Boston got 52 Google reviews in just a couple of months. I mean, they leverage our tool, and they're also working with their therapists to have those one-on-one conversations. So they're almost an outlier in terms of 52 reviews is incredible, right? But even when you go into Physical Therapy Boston, Mullis and Associates is a tiny customer of ours, and they've got 23 reviews. They're ranking for a search term that's really tough to rank for, Physical Therapy Boston. And it works almost across the board. Even in more rural places like Colchester, Vermont, our customers are ranking first, 13 Google reviews, all 5 stars. It's just automated, where we're making sure that those satisfied people are getting that information.
Great.
Making it easier for them to fill it out. And obviously, once you understand who those evangelists are, you can do lots of cool things, funnel into post-discharge classes. You can also, 6 months after their discharge, say, hey, how are you doing? If you have any pain, give us a shout and we can get you back into the clinic, and just, effectively start to manage your patients in a way that works for you.
Awesome. That's a great, a lot of clinics, you don't realize how either satisfied or dissatisfied your customers are. You assume that people walk out happy, but what is it, for every verbal complaint you have, there's 20 nonverbal complaints?
Exactly. Yeah. And that's the thing, is I think we all for one, satisfaction with physical therapy is overall pretty darn high. But I also think there's a skew there where the only people that we're really asking if they're satisfied are the people who made it to discharge day. You know what I mean? It's the discharge people. We're like, hey, fill out the survey, by the way. Of course they're happy. It's their last day. They got better. But like, what about the people who left 1 day in or 2 days in? Those are the people I care about too.
Yes. And you showed me previously integration with TheraVid.
Yeah.
Does that come with the package, or is it an additional?
Yeah, no, it comes with the package. And what we have here, right, this is our marketing automation tool. But when we talk about what StriveHub is in total, it is a customer relationship management tool. So essentially, you know, if we come into the platform, we have 3 pieces. StriveHub Reach, which is what I just showed you, but we also have a really nice patient portal and home exercise program. The home exercise program is really simple. It makes it easy for clinicians to create home exercise programs. I mean, everyone knows what one of those things are. But the patient portal itself is pretty neat in that as soon as the home exercise program is created, what we can do is automatically onboard the patient onto the portal and allow them to, log in with just a click of a button. So I won't go through the home exercise portion, just suffice it to say we made a nice home exercise program that makes it easy. I will go into the patient portal quickly and show you what the patient starts to see, right? So they log in, and I think a lot of home exercise programs do an excellent job of allowing patients to check out their videos online, which is important. But for us, we really see it as more than that. We want our portal to be engaging in a way that patients continue to come back to it. So what you have to do is, aside from putting exercise videos on there, we also need to have some interactive features where the patient can quickly start to give feedback back to the therapist and say, this is way too easy, right? Or something like that. And on the flip side, say, you know, this is too hard, or just send a generalized question, log their workouts over time, log their pain over time, and we can start visualizing that to the patient so they can start tracking how they're doing. Obviously, we want some more outcome scores to be on here, and we're consistently working on those types of visualizations. But you know, from a high level standpoint, we want to provide a deeper level of engagement online than the traditional portal for physical therapy. And we're seeing that too. We're seeing, you know, 60% of patients are logging in, and they're on average logging in like 6 or 7 times within a course of care, which is twice a week for, you know, 4 to 5 weeks.
That's high, actually.
Yeah, it is. Yeah. It's good. We're surprised by that number, especially because compliance with AGPs is so darn low, right? And then lastly, when you log in as a clinician, you'll start to see these cool notifications where you can click into your notifications bar and it'll show you which patients are viewing their videos. Like Lindsay just viewed these. She also viewed them yesterday, or not yesterday, but last week. We'll dismiss them and go into messages, and you'll see that, again, Lindsay said, hey, this exercise is a little too easy, this active assistive shoulder abduction with cane. So what we can have you be able to do is answer that message if you want to, but also you can click into Lindsay's name. It's going to pull up her patient information, and you could say, all right, I want to edit that. I want to, you know, get rid of the exercise that's too easy and maybe add in shoulder abduction active range of motion exercise, and submit. And Lindsay's going to get an email that says, hey, your exercise routine has been updated. As you can see, I love to open stuff in new tabs instead of opening it within that tab. But Lindsay's going to get an email that says, hey, your exercise routine has been updated. Click here to view. And just sort of, you know, it allows you to be responsive as a physical therapist.
Right, I think it's really important. I mean, I think the reason why I reached out to you to do this interview, because I think the product, it's so important to look at customer satisfaction. And I think working for companies other than physical therapy companies in the past, other companies have realized that. But since most private clinics, unless you're a huge corporation, you don't really realize how important that is for retention and to have those evangelists. And I think that, just I think other platforms have tried to do this, not so much with the integration you have. So that's why I think that this is such an amazing platform that you should consider if you're a private practice owner.
Great. No, and I appreciate you having me on. And we're excited. I mean, what we're doing is essentially we're just physical therapists. We have some technologists too, but we just want to try to provide our profession with the best tools possible to succeed and move forward.
Awesome. If you have any other questions, you can reach Ryan at StriveHub.com.
Yep. Or Ryan at StriveLabs.com. That's the name of our company too.
Okay. And I will include all the links to the product and how to reach Ryan on this review and my YouTube channel. So thanks for watching, and have a great day.